Hello, my name is Karen Saki, and I am doing my presentation on calcium supplementation and more in depth of the effects it has on the female athlete triad. Okay, so what is calcium? Calcium is a mineral in the bone, mineral in the body that the bone needs to function. So things such as teeth and bones contain most of the calcium, and then other components such as nerve cells, body tissues, blood, and other body fluids contain the rest of the calcium that is needed. So in addition to a sustainable level of calcium in the body, um, in addition, the calcium is needed to mostly prevent the formation of osteoporosis, which is the weakening of the bones. And it typically happens in older patients. And so in addition to the calcium, vitamin D is necessary to efficiently promote the absorption of calcium into the bones because the vitamin D is actually really helpful for that. And so this is a table that it's a recommended dietary allowance, or the RDA, of calcium. It shows divided up through gender and age. So as you can tell that there's definitely a need for the calcium for the body to function. So in addition, so people who follow a vegan diet, are lactose intolerant, consume large amounts of protein or sodium, or have osteoporosis are considered considered at risk for low calcium ingestion. So those who typically do not reach these recommended RDA values are encouraged to take calcium supplements. So what is the female athlete triad? The female athlete triad is a medical condition that is, it connects menstrual dysfunction, so the functional, kind of the amenorrhea, with the low energy availability, that's with or without an eating disorder, and decreased bone mineral density or osteoporosis. So typically when one sign is shown, the other two follow, which can lead to career-ending injuries for athletes and even an early diagnosis of future problems to their overall health, such as the osteoporosis. So, so athletes who do show signs of low mineral, low bone density with things like subsequent stress fractures, or yeah, they're encouraged to take calcium supplements to kind of promote their bones to reabsorb all that calcium again. So the lack of calcium in the bone can be due to either a lack in their diet or excess sweating, which is a waste disposal system for the calcium. So bone density. So bone health can be determined with a bone density test by the dual energy X-ray observatory, which is also short for a DEXA scan. So recorded values are compared to a set of norms. There was a study done that measured the bone mineral density of female orienters, cross-country skiers, cyclists, and weightlifters. And the bone mineral density, or the BMD, was measured at the lumbar spine, femoral neck, the femur, the patella, the proximal tibia, calcaneus, and the distal radius by this DEXA scan. And the results indicated that weight training provided more bone stimulation for bone growth to occur. So the body parts that the DEXA measured was kind of all where a lot of stress occurs within those bones at those joints. So it was that kind of showed like where the major stresses are and see the effects that the bone goes through. So endurance athletes versus strength training athletes. So what types of exercise exactly affects bone health? So a study was done at the University of Michigan which reviewed data to determine what exercises impacts bone mineral density. So the kind of the three factors that were looked at were the magnitude of muscle strain an exercise exerts. So typically they looked at like the weightlifting and gymnastics due to the amount of force that the body goes through. Another factor they looked at was the rate of muscle strain an exercise exerts. So that's like the speed of high impact exercises repeated. So that's like tennis when they go like side to side and do kind of those quick motions, and plyometrics, which is a lot of like jumping and using your joints and using your bones to pull fully use your power and strength. And the third factor they looked at was the frequency by which the muscle strain occurred. So that was kind of like the running, which is it's not only repetitive, but it occurs for a long duration of the time that they exercise. So the risk of calcium supplementation. So calcium, of course, is a vital mineral in our bodies to function, and um, it is important to make sure that you have the right amount of calcium in your body, but too much of it can lead to detrimental health effects. So a condition called hypercalcemia can occur, which is the overdrive of calcium production, and it's usually a result of the parathyroid gland working too hard. One cause for the one cause for the hypocalcemia is taking too much of calcium and vitamin D supplements, which is one of the major causes of why that occurs. So some symptoms that occurs are um, some symptoms occur when the body detects too much or a surplus of calcium in the blood. So one symptom is excessive thirst or frequent urination, and this is due to the kidneys working hard to filter out the calcium because it's too much of it. So the kidneys work overtime to get rid of it. Another one is nausea or vomiting, and that's due to the stomach experiencing a surplus of calcium, hard when which is hard when chemical digestion has to occur, and it affects the stomach lining more. And another one is the bone and muscle weakness, which you wouldn't think would occur, but because there is so much calcium, the calcium is actually getting leached out in the bones. So this makes the bones weaker and can lead to osteoporosis. So, and another surprising factor is depression because hypercalcemia it interferes with how the brain works. So this can lead to uh, um, imbalances of the chemicals in your brain, which can lead to depression. And then in severe cases, there can also be heart dysfunctions. And sport dependent. So depending on the sport, athletes showed different signs of bone mineral density. One study conducted looked at college athletes of, okay, sorry. One study looked at college athletes of gymnastics, softball, track, field hockey, soccer, crew, swimming, and diving. And of 99 of these athletes, 23 of these were amenorrheic, which means that they had a lack of a menstrual period, or a gliomenorrheic, which is infrequent menstrual periods. And study was done similar to the DEXA scans that talked about in the last study, and results indicated that the runners had the lowest body of bone mineral density for all sites except the legs when compared to gymnasts and softball players. And swimmers and divers also had a significantly lower leg bone mineral density than all the sports. So it kind of makes sense about how the runners had low mineral low bone min, low sorry had a low bone mineral density for everywhere except the legs, because the legs are where most of their where they're stressing most of their their body parts when they run. So the lower extremities have the most stress, so that would make sense because that's where most of their bone stimulation is occurring, and that's helping it build the osteoblasts. And then similar to the swimmers and divers, they're not using their bones as much, and they're not placing their body under so much stress. So that would explain why they have a lower bone mineral density there. So another study was done, which to understand the influence of sports participation and the female athlete triad on bone mineral density in female collegiate athletes. So there are 239 females in 16 sports, so kind of has a wide variety and a wide diversity of sports there. And they all completed a DEXA scan to measure BMD Z-scores of the lumbar spine and the body. So the sport that were looked upon were synchronized swimming, swimming and diving, crew/rowing, cross country, gymnastics, volleyball, basketball, and softball. Triad risk, so the female athlete triad risk assessment variables were obtained from pre-participation examination. So that was something that they recorded. They were asked, have you had an eating disorder before? How many periods have you had within the year? Have you had any like stress fractures, things of that nature? And within the study, they hypothesized that high impact and multi-directional loading sports will have the highest bone density, bone mineral density, whereas the non-impact and low impact sports will have the lowest bone mineral density. So after they've done the DEXA and they looked at their scores, the results indicated that synchronized swimming, swimming and diving, crew and rowing, and cross country had the lowest average bone mineral density, while gymnastics, volleyball, basketball, and softball had the highest averages. So this showed that, so like the sports that were like the gymnastics and the volleyball that are the multi-directional and the high impact sports had the highest bone mineral density, while kind of more like the synchronized swimming, the swimming and diving, crew, they're the lowest impact, so that would explain that they would have the lowest amount. And then the cross country, they're not so much of a multi-directional loading. It's more of they would have the lowest because they may be placing too much stress on their body. So this kind of showed that all sport types and triad risk factors influence bone mineral density, and athletes in low impact and non-impact sports and athletes with low bone BMI and aggliominora or the aminora are at the highest risk for reduced bone mineral densities. So overall, should athletes take calcium supplements? Calcium supplements, even with considering the benefits and the risk of each factor. And so the short-term bone health, which are like the stress factors, and then the long-term bone health, which are the osteoporosis, are important factors to keep in mind when an athlete is experiencing symptoms of the female athlete triad. So bone growth is ultimately stimulated by the force that the muscles and the gravity to put pressure on the bones, the force of the muscles and the gravity. So those two kind of factors impact the osteoblast more. So this is why like runners may have higher BMDs in their legs due to the constant stress they force on their lower extremities. Therefore, endurance and strength training exercises are good for bone health. However, when they weaken due to overtraining, hormone dysfunction, or insufficient nutrition, which are all kind of three signs of the athlete triad, they will start to experience a decrease in bone mineral density, which can be shown through stress fractures or just aches and pains here and there. So when an athlete is suspected of low BMD, then calcium supplementation is recommended. Once the athlete has restored calcium into their bones and they're getting stronger and they aren't showing any signs of bone weakening or subsequent like stress fractures or like that, then they should start like weaning off of supplementation to avoid the complications of the hypocalcemia, because that would can lead to other effects and other health problems in their body. So these are my references. And yeah, thank you.